Hey everyone, I wanted to make a quick video about the nursing program, specifically the LPN, RN, and on up. I'm right now a second semester LPN student, and for those who are thinking about going into the nursing program, no matter what field or rank you want to go for, I say go for it. I originally didn't even want to go into nursing. I wanted to go to pharmacy school or med school, but after several years in college and just getting fed up with it, and of course the money, I decided I don't think I could have handled it. So I thought I'd see if I could get into nursing school, give that a try, and see how that was. And I did. I got in relatively easily, and so far it's really good. It's awesome. You learn a lot, a whole lot. Sometimes it can be very overwhelming. Because if it was easy, everybody would be doing it. But it's also very rewarding once you get into the clinical settings and you deal with your patients and you start to actually apply what you've learned in the class and in lab, and all the little tricks and tips that your teachers and preceptors tell you, and the fellow nurses on staff. They tell you different things to learn and to look out for the future. So it's very, very helpful and very rewarding. Now, as far as for those who are not in it yet but are curious about wanting to get into it, what to focus on, to study for, definitely science will be a big help. Chemistry, biology, anatomy, physiology, all those things are so much help. You don't know it yet if you haven't had it, but it will. You'll see it once you get into class and you start actually learning how the body processes things, especially between pediatrics and geriatrics. You'll definitely see the different variations in the human body. Now, for the LPN, you don't have to have, well, certain colleges, mine doesn't require anatomy and physiology 1 or 2. You don't have to have that. You don't have to have microbiology. I already took it because like I said, I was trying to go to med school, so I took it. But when you do go for the RN program, you will have to have A&P 1 and 2. You will have to have general chemistry. You don't have to have college chemistry, just Chem 101, the basics. And I think some programs require microbiology, which, as you get into the different, disease processes and things like that, that will come into play. And let's see, I think that's relatively a pretty good outlook. Of course, general education, English, math. You don't have to have calculus, so don't worry about things like that. You're never going to use that. It's just basic mathematics. You're not going to use trig or algebra. It's going to be basic mathematics for the most part. Until you get into drug dosage, that can get a little confusing for some people, but I've worked in pharmacy for over 3 years as a pharmacy tech, so I've already got that good background already, so drug dosing and pharmacology is a good help if you already work in pharmacy or have some pharmacy background. As far as the breakdown between LPN, RN, so on and so forth, the LPN program, at least at my college, every college has their own way of doing things. My college it's a 3-semester program. So you'll graduate in a year and a half. Now, that does not mean that fresh out of high school, you're going to graduate in 3 semesters. Some colleges will require you to have prereqs. Like I said, the certain sciences and math and English. Now, if you've already got A&P classes done out of the way, you're probably already ahead of the game. For those that don't, or like me, was just a regular student, you'll have to take prerequisite classes to get in before you can even apply. Because if you don't even have those classes, you can fill out the application, but they're going to deny you, saying you haven't met the prerequisite requirements. So I think that took me. Well, I already had them out of the way because I've been in college for many years, but I would imagine for somebody who's just getting into college, hasn't taken any classes yet, it would probably take 1 to 2 semesters for prerequisite classes before the application time. So I would do some research for your college or your institution, find out what prereqs you got to have, when the application time frame is open, because they're only open for several weeks and you can't apply before or after. So knowing those 2 things, you can plan out what classes you need to take during which semesters, and then based upon that, you can pretty much get a benchmark for where what time you need to apply for. That way, you're not waiting. Sometimes you'll have to wait a whole year because some programs go lockstep. They don't intermingle from one to another. So if you get that out of the way, or you get that sequence in order from the get-go, you'll be ahead of the game, and you'll be able to better focus on getting it done quickly, easily, without too much added stress, things like that. Now, after the LPN program is the RN. And for those that just want to completely skip the LPN program, that's fine. I know a lot of people that have done that, and they do really well. Again, they have prerequisite classes, like I said, the chemistry, A&P, microbiology, nutrition, sociology, philosophy, things like that. Again, check with your advisors which courses are prereqs and which are co-requisites, which means you can actually take those during your nursing program, but you have to have them completed by the time you graduate. If you start out from high school, you'll have to get your prereqs out of the way. That takes about a year, because I knew some fellow students when I was in A&P, they were doing that. It took them, you have to go for 1 and 2, A&P 1 and 2, so fall and spring. So that's, you pretty much have to have a year of classes done before you can even apply to the RN program. Now this isn't necessarily true for universities, because they have the BSN, Bachelor's of Science in Nursing, and you can actually apply to that and don't have to have your RN. But that'll take several years. It'll be a 4-year degree. It won't be a 2-year degree, because that's what an RN is, a 2-year degree. BSN is a 4-year degree. As for the RN program, the time length, like I said, you pretty much have about 1 year of prerequisite classes. Then you'll have 2 years of the actual nursing program. So you're pretty much looking at 3 years right there. Now the benefit of that, especially if you're at a community college, it's pretty darn cheap. Now I don't mean, like dirt cheap, like you're not going to pay anything, but it's a whole lot less expensive than university. Again, you can look at the financial aid, talk to them, see what kind of, what the price is, in-state, out-of-state tuition, things like that. Now, I didn't apply to the RN program because, one, I already missed the deadline. I didn't have all my prereqs out of the way at that time, so I wouldn't have got in even if I had applied. Plus, I didn't want to get into it if I did and then drop out or fail, because if I'm not mistaken, and don't quote me on this, but I think most facilities and programs, you get 2 chances to do the nursing program. If you drop out or fail out, that's 1 chance. You only got 1 more shot. And if you fail that or drop out again, you can't apply again. They won't accept you. Now, I don't know if that means that you can't apply to another school, but at my school, that's what their guidelines are. So, getting to know the nursing advising, the financial aid office, pretty much anybody in the nursing program, the department heads, things like that, get on a good touch first name basis with them. Let them know you're interested. Get as much information as you can. They've got pamphlets that talk about what to expect in the program, what's it like. Let's see, for my class, the LPN class, we started out with 16 students in our first semester, and we are probably, I think, in week 3 of the second semester, and we're down to 10. Now that doesn't mean, oh God, that means it's so hard and everybody failed. No, a couple people did. You're going to have people that fail. There always is an attrition rate, which means there is a percentage of people who will drop out, guaranteed. It's going to happen. Other people have personal circumstances that they needed to deal with, to where they felt the need that they could not continue the program and deal with whatever situation was going on in their personal life, so they dropped out, which is fine. I mean, like, you'll hear if you get into the nursing program, you'll hear a professor say, everyone's got a bad day. You're going to have something come up. So don't worry about that. Just focus and study hard. Don't think it's going to be, I just got to read, the objectives or the bullets, and just breeze your way through it. You will drop it. You will fail if you do that. What else was I going to say? Don't think that like I've been in college for going on 8 years now, not including the nursing program, um, and I've got a pretty good grasp on how to study for classes. I'm not, the best, not the worst, but I've got a pretty good idea of what to do. Um, Nursing will change your way of studying. I don't care who you are. You will have to completely change the way you study, because it's not, like I said, it's not just read a couple pages or read the outlines and think you're gonna ace it. If you do, you're a rare breed. You pretty much need to read every page of every chapter, all of your notes, all of your outlines. Some of the books will actually have like a little mini handbook, which will have like chapter questions and fill in the blank, crossword puzzles, all these things to help you, recap what that chapter was talking about. Do it. Get that book with it, because it's going to help you. I mean, you may say, oh, it's so expensive and all this stuff. Well, yeah, it's expensive and it's tough, but that little bit of help will go a long way come test time. Another thing that I learned, and well, pretty much everybody in my class learned, there is no way to prepare for it. It's learn on the job. Well, in this case, learn on the test. It's not. They do have knowledge-based questions. Like what is anemia? What is hypertension? What's myocardial infarction? Things like that. The vast majority of questions you'll see on your weekly tests will be scenario based. And what I mean by that is patient presents with such and such blood pressure, heart rate, respirations, O2 sats, all that kind of stuff. And what do you do for them? You got A, B, C, and D to pick from. Most courses don't teach that way. They're pretty much all, you got to know, what does this mean? Knowledge based. So that's going to throw a lot of people a curveball, and they're going to have to adapt to that. So just be prepared for that. HESI test. That is the bane of every nursing student's existence. What that is a test, and it's an acronym. I can't remember what HESI stands for, but it's a test that the end of every semester, every student has to take it, and basically, it's a test to see if you knew what you did in the first semester, and it recaps everything. It's comprehensive, and you got several. I think every college has their own number of chances. Our college you got 3 chances to pass it. If you don't pass it by the 3rd one, you fail and you're out. And like I said, you take that test every semester, at the end of every semester, to go on to the next semester. So for me, LPN will be, after my 3rd HESI test, then you have graduated from the LPN program, which is a certificate. It's not a degree. The RN is a 2-year degree. It's an associate's. After you graduate with either your LPN or RN program, you go to take your state boards. And I'm not going to say what's on that or what to study for that, because I have no idea. I haven't taken it. I haven't even prepared for it. That's, weeks down the road. But it will be challenging. It will be rough. It will give you gray hair if you don't already have it. And as you can see, I'm not a female, so don't think that men can't do it or don't want to do it, because we do. There's a whole lot of men that are in the nursing program and are nurses. And we had 3 guys in my class, and now I'm the only one, with 9 other girls plus my female teachers. So yeah, if you're a male trying to get into the nursing program, expect to get picked on. You will. It's going to happen, especially when you get to different sections, especially dealing with the reproductive systems. You're going to get a whole lot of jokes and stuff. So be prepared for that. It's nothing bad. It's just fun. Clinicals, those are interesting depending on which facility, which avenue. Whether it's geriatrics, whether it's ICU, what have you, or anything. Don't freak out, because Everybody in my class did. We all were going, what are we going to do? What do we deal with? Well, we've never done this before. Everyone will feel that way. Unless you're a CNA, then you already know what you're doing, for the most part. Don't sweat it. The teachers are going to tell you what to expect, what you're going to be doing, which clinical sites you're going to go to on what days, with who. I'm not going to tell you what we did, because it's private. But just don't worry about it. It's going to be fun. You'll probably experience some gross stuff. If you can't handle blood and all that, then it may not be the best field for you. But just have fun with it. You're going to have stressful days. You're going to have great days. Just take it as it comes. It's all just one day at a time. Like my teacher told us, she said, you guys aren't stupid. You made it here for a reason. You're smart enough to make it through. We wouldn't take you if you weren't. So you're going to have times you're going to feel like an idiot. You're going to feel, oh my God, am I just the stupidest person on earth? No, you're not. Like I said, you made it. So you have to take it. Oh, and you also have to take an entrance exam to even get in the nursing program, for the LPN, RN, and on up. So if you make it past, first you got to make it past the application process. Then you got to make it past the entrance exam. Then you're in. So that weight is lifted off your shoulders. So just don't worry about it. It'll be stressful, but if you put your heart into it and you put your mind down to it and you just focus and focus and focus and just try your best, get in groups, study groups. Don't do it on your own. That's not a good thing to do, because what if a person over here knows something that you don't and you never asked them? You're never going to know what that was. So get to know your classmates. Don't be the one stuck in the back of the class by yourself that doesn't want to talk to anybody. Try to make friends, because you're going to be there for several semesters. You might as well get used to them. So just have fun. That's what it's there for. You're not there to be a robot. You're there to have fun. It's going to be a career. You don't want a career that's going to be boring. So I think that's pretty much it. If you guys have any questions, comments, or whatnot, just feel free to let me know. I'll try to answer them as best I can, as quickly as possible. All right, take care.